Hey guys, I'm Dr. Eric Gifford with Evolution Health and Wellness Center. Tonight we're going to talk about hormone optimization, what hormones are, what hormones we can optimize, and how that can make you feel. So in general, hormones, particularly testosterone and estrogen, really change over time. As we get older and older and older, our hormone levels get lower and lower and lower, and that affects how we feel. So you wonder why you feel fatigued, why you feel just moody, or why anxiety and depression start to creep in as we get a little bit older. Well, it's not just everything to do with our life, it actually has to do with our hormone levels. So libido, all of these things are affected. When you'll hear people talk about hormone replacement, they're thinking like, okay, is this just for gym rats that are just trying to bulk up with testosterone? Or is it just women that have had their uterus or ovaries removed? No, it's actually just everyone in general. We start to see these levels drop over time. And what we can do is we can optimize those levels to get them back where they were when you felt most vibrant and alive. And that's usually, in your 20s and 30s, and then they just start to taper off. So tonight we're going to talk about what they are, how they work, and what we can do to optimize them, particularly if you've been affected by the levels dropping over time. All right, so my personal testimony with this is I didn't really think I needed any hormone replacement because I was like, I train, I do triathlons, I feel good. I don't think I need that. My wife, same way. She's like, I'm just fine. I don't think I really need anything. Well, we both did it just to see, obviously how it would feel, and we wanted to be able to tell our patients, how we were affected by it. Well, it blew our minds because we didn't really realize what we were missing because, again, it happens very slowly and gradually over time. As your levels start to drop, you just feel tired, you feel fatigued, you have less energy, you have less libido, and you just don't even know it. So my wife had gotten pelleted. We did a testosterone pellet with her, and she's like, I feel a little bit more energy, and I guess I'm sleeping better, but I don't really feel anything else. And I'm like, okay, well, let's see how it continues to go. One day, this is probably a month into the process, I'm sitting at my desk doing charts like I normally do in the morning. She dropped the kids off at school. I hear the door shut, and she walks by butt naked. Okay, obviously I'm like, whoa, what is going on here? Because that's never happened the entire time we've been married. Well, that was her increase in libido. Suddenly she was like, hey, I enjoy this. It feels good. And hey, I'm interested. And that's something, like I said, it just hadn't happened. It had always been my idea. And again, we have 4 kids and I thought everything was functioning just fine until that happened. And I realized, whoa, what was I missing out on? Again, that's just my testimony. Like I said, everyone has a little bit of something different that they're either missing or they feel is lacking in their life. But that was something we didn't even know we were missing until we got it replenished. And suddenly we're like, whoa, this is awesome. All right, so without any further ado, I'm going to go ahead and start the presentation. So again, I'm Dr. Gifford. This is Evolution Health and Wellness. This is my wellness practice that I also have in addition to my orthopedic practice. And tonight, again, we're talking about hormones. So what are hormones? Hormones are chemical messengers that basically the body utilizes to send signals to either other organs or other areas of the body to perform and do functions. So in the men, primarily the hormone is testosterone. And in women, they have a little bit of testosterone and a little bit of estrogen. And these hormones are throughout the entire body and trigger a lot of different responses that have a lot to do with how we feel and how we function. And these are the biggest hormone signals in our body, and they really change over time. So, symptoms of hormonal imbalance. We kind of touched on a few of these, but fatigue, you just feel tired. You're just done at the end of the day. Mood swings, you're angry, you're whatever, you're just agitated. Brain fog, poor memory. People will describe, I just can't remember anything anymore. I walk in a room and don't remember why I was there. Not just because of ADD. It's actually brain fog. You're just not functioning as clearly as you could be. Anxiety and depression. These are just drops in hormone levels, and now you just feel anxious or depressed. Hot flashes and night sweats. This is particularly with women with estrogen loss. They just start to feel those. Those are signs of menopause. Weight gain. So you're going to pick up more fat. You're going to lose strength and lose muscle. Headaches, migraines, decrease in libido or performance, either one. Joint pain, stiffness, generalized body aches. Again, that's just your body doesn't feel as good because all of those hormones are just off. So what can we do? Obviously, if we're not performing well or we just don't have any drive, it can dramatically affect our relationships. And again, if one person's feeling great but the other one's not, again, that's not a great relationship. We need both parties to feel good, have good drive, and have good energy to make that relationship really work. So what is menopause and andropause? These are when the sex hormones, particularly in menopause, it's estrogen. This is while the body is in its normal cycles, you are producing, you're ovulating once a month, and this is for reproductive purposes. Well, as the body ages, eventually you run out of eggs, your ovaries are now empty, and you're no longer going through that ovulation process, and your estrogen levels start to drop. And they drop dramatically, so estrogen really starts to tank. And you also have a little bit of testosterone in women, and these levels just really go down. Now, there's something important to understand. Menopause is not something that you're going to pass through. Menopause is something you open the door, you get in, and you never leave. Your estrogen levels drop, and they're never coming back. And so when people say, oh, I went through menopause, well, no, you're still in menopause. You're postmenopausal. Means like your estrogen stopped, or your ovaries stopped producing estrogen, and now those levels are gone, and that's where you are. That's a permanent position. Now, you can start feeling symptoms of hot flashes or night sweats 15 years before you stop ovulating. And it's, again, symptoms that are going to last potentially a lifetime. So don't forget that that's not just something you're going to pass through. It's actually, once you get there, you're there. And we can do things to make it feel much better than having all those symptoms. All right, so what is andropause? Andropause is the men's version of menopause. So again, every year our testosterone levels drop. So when we're in our teens and 20s, we feel great, we feel vibrant, we're the strongest, we're the best we've been ever. And each year it just starts to drop, and just starts to drop, and just starts to drop. And every year after, it's just lower and lower and lower. Now, there's some things you can do with like weight training and exercise that can help boost testosterone, but ultimately it's still going to naturally drop over time. So in men, we think it drops anywhere from 1% to 3% per year, and in women it drops dramatically. So women get into their, say, like 30s, and they start to drop potentially 50% per year. Some of the women that we check, literally, they have next to zero testosterone in their body. And again, our body needs testosterone. And so that's not good. All right, what can we do to get our hormones back? Obviously, we're going to be talking about this tonight. It's hormone optimization. We're going to try to replenish your hormone levels back to where they were when you felt your best. So this is another important thing I want you to understand. In traditional medicine, so when we go through med school, you're obviously trained in physiology and all these things, and so we learn how the systems work. And now in practice, we start to get into our residency and our fellowships, and we start to look at, how do we practice? Well, we look at lab values, and this is where people can kind of get hung up. We look at lab values. Lab values are based on an average value for a certain variable such as age, sex, and race, okay? So if I'm looking at say, testosterone level for, this patient, well, guess what? You're gonna take the average, so right here, and you're gonna go about 2 standard deviations over to either side, and that's all considered normal. This guy doesn't feel great. This guy may feel all right. This guy probably feels pretty good. But this is all considered normal. So when a doctor or your practitioner looks at this, they look at it and be like, oh, nope, you're in the normal range, so we're not gonna mess with it. Well, I don't feel normal. I feel awful. I feel tired. I feel fatigued. I just don't have any libido. I'm just not feeling good at all. Yeah, but you're normal, so we're not gonna touch it. That's traditional medicine. And unfortunately, that's how we're trained, because we're looking for something, and if it's not abnormal, we're gonna leave it alone. We're not gonna focus on it. Well, in this practice, or in somewhat of a more functional practice, we really look at how you feel, not just what your lab levels say. So you may be up here in the average range, but you still don't feel great. And if we bump you up here in this range, you might feel great. And that's gonna solve all the problems. So again, we look at it as based on your symptoms and your lab values, and try to get you into that happy medium. All right, so human identical hormone replacement. This is another important topic I want to talk about. So the hormones that we have for replacement that are prescription or FDA approved are going to be synthetic. Okay, so if a guy's getting testosterone injections, typically that's testosterone cypionate. It is synthetically derived from horse urine. Okay, well, it's not the exact same component as what the human body has. So what we like to do is, instead of using anything synthetic, we like to use a bioidentical hormone. Now, bioidentical hormones typically are derived from plants, in particular like yams, like sweet potatoes. They can derive estrogen and testosterone, and it's the exact same molecular structure as your natural body's testosterone and estrogen. So there's a big difference between having something that's synthetic, that's not the exact same molecule, versus something that is truly identical. So when you hear the term bioidentical hormone replacement, we're talking about something that is literally the same hormone or the same molecular structure as what your body naturally has. And that's a very important thing. So we like to use the bioidentical hormone replacement instead of your synthetics. All right. So different delivery methods. How can you get hormone replacement? There's lots of ways. Again, a lot of people will do oral estrogen, and unfortunately, this can cause upset stomach. This also goes through what we call first pass metabolism. That means it goes into your stomach, it's absorbed, and then it has to pass through your liver, and then it gets broken down or repackaged and then shipped out to the rest of the body. So again, you're not getting the full effect because it just got processed through the liver and it's just very broken up and different. It also, you have to take it multiple times a day, up to 3 times daily, to abate those symptoms. So it's not ideal because you have to do it so often, and again, you have to go through that first pass metabolism. Topicals, they can cause irritation, they're not necessarily well absorbed. They also can be transferred to others. So if you're taking testosterone and you're rubbing that cream on, or androgel, and you're rubbing that cream on several times a day, guess what? Every time you pet your dog, you may have rubbed that off on the dog. Every time you hug your wife, again, that may rub off on her. Your kids, anything, you name it, that is being transmitted from your skin. So again, that's less than ideal. Plus you have to do it up to twice a day to get the effects that are desired. Injections are a way that we actually do those as well. But injections, if you're doing them properly, probably need to be done about twice a week. And unfortunately, you get a roller coaster effect. So you get a high, and then you'll get a low. And you'll get a high, and then you'll get a low. Because those hormones are being injected, again, if you did it twice a week, a lot of times those hormones are injected once a week, and sometimes even once a month. Well, that's not going to be very effective because you're going to get a real high, and you're going to get a real low, and then that's not effective for making you feel good. So we like to use pellets. You can see that one flashing on the side. So pellets means that we're going to take a bioidentical hormone. It's been formulated into a pellet, and then we're going to insert that under the skin, and that's going to be absorbed slowly over in women 3 to 4 months, in men 4 to 6 months, and that's just there, and it creates a steady state hormone level. So it's just steady as it goes. So we're not taking something every day. We're not injecting something every other week or every week or twice a week. We're not applying something on our skin. It's literally there. We don't have to worry about it. We can just forget about it, and it's there. It keeps your levels up, and that's the ideal way to go. You want to get that level there, and you want to keep it there, not ride that roller coaster. So that's how we prefer to do it. Let's see. So benefits of hormone optimization. We talked about this because obviously, what are your symptoms? Well, those are the symptoms we're going to try to improve. So increased libido, sex drive, your relationships just go through the roof because you have desire for each other, because that libido or sex drive is back. And it's usually, in all honesty, when we treat one person, we usually end up treating their spouse, because the one sees, well, they feel amazing, I want that too. But again, you can see how that would really nurture the relationships because of that increased libido and sex drive. So improved mood. So some people they're anxious or that may have some depression, they can get off some of their other medications because this naturally improves your feel-good hormones and your mood. This also dramatically improves your memory and just clarity of thought. More energy, so you're just feeling better throughout the day. You don't necessarily crash at the end of the day or in the middle of the day. You just feel good. You gain muscle mass, so you increase strength, and overall you decrease fatty tissue and you increase muscle tissue, so your lean mass is improved. You feel younger, you feel healthier, and you feel happier. Okay, that's awesome. That's what we all want. So As an added bonus, these are things that don't necessarily, you're not going to notice how you feel, but this is significant. So it improves bone density, it protects the brain from Alzheimer's dementia, and it lowers the risk of heart disease. All right, so how does that work? So in bone density, when your estrogen levels, particularly in women, when estrogen levels start to drop, when you are menopausal or postmenopausal, then your bones start to deplete their calcium. They just start to pulls calcium out of the bones, and that dramatically decreases your bone density. So that's why you run a significant increased risk of osteopenia, osteoporosis. Well, if we can supplement that estrogen levels, that stops the leaching of the calcium from your bones, which improves your bone density. Testosterone also helps build bone density back up naturally. Now, there's lots of prescription drugs to help with bone density and whatnot. They have a lot of side effects, and in all honesty, sometimes it makes your bones brittle, which is, again, less than ideal because that sometimes even increases the risk of a complicated fracture from, say, falling and breaking your hip. But if we can naturally improve your estrogen level, which will stop the bone depletion, and then we give you testosterone, which actually helps you develop stronger bones, again, that's ideal. So next, brain health. So in brain health, when we're talking about Alzheimer's dementia, believe it or not, women are 8 to 1 more likely to get Alzheimer's dementia than men. Okay, that's a big risk. Well, guess what? Women on estrogen replacement are 50% less likely to develop Alzheimer's. All right, so you're already way more at risk, but you can cut your risk in half by being on estrogen supplementation. So it's very similar with men. Men with low testosterone are 3 times more likely to develop Alzheimer's than men that are on testosterone replacement or have a healthy level of testosterone. So again, very important for the brain. Heart health. Okay, how in the heck does this help your heart? Well, believe it or not, estrogen and testosterone both improve your lean body mass. Okay, so you're less fatty, you're more active, and so you're keeping that heart moving and pumping well. But it also has significant improvements on your lipid profile. So you're going to decrease your bad cholesterol, which is LDL. You're going to increase your HDL, so that's your good cholesterol, and you're going to decrease your triglycerides, which is just your fats that are in your blood. And so this, again, improves the way your heart can function and reduces the risk of heart disease and heart attack in the long run. All right, so why would you not want to do this? This seems obvious that this seems like a good idea. Why would anyone not want to feel healthy, happier, and just overall vibrant? Well, okay, here's what has been told to people in the past. Estrogen, if you give somebody estrogen, that increases your risk of endometrial cancer. Well, that is true. There was a study that came out, and this is part of the Women's Health Initiative, and this is what scared everybody away from supplementing estrogen or hormone replacement. It was somewhat of a flawed study because they didn't necessarily give you the other alternatives or the other options. So it turns out if you give unopposed estrogen, meaning estrogen without progesterone, it can increase the risk of endometrial cancer. But what they did not say in that study is that if you take estrogen, but you also give it with progesterone, so not unopposed, you actually giving it with progesterone, this actually showed a decrease in the incidence and mortality of endometrial cancer. Wait. That's the exact opposite. Yes, it is. So again, if you give it estrogen alone, it can increase your risk. It really can. If you give it with progesterone, again, it actually has been shown to be protective. So again, that's very important to remember. We always give it with progesterone. If you have your uterus and this kind of stuff, we're always going to give it with progesterone because we don't want to increase your risk. But again, you can see the flaw in that study. They just showed this part. They didn't show the second part. Also, estrogen. Let's say if you've had a breast cancer that is hormone receptor positive, so meaning like its response or the breast cancer was somewhat either due to estrogen or responsive to estrogen, that means that you probably aren't going to want to get supplemented with estrogen. You've cleared the cancer, you've had a mastectomy, you've had radiation, chemotherapy, whatnot, but still, we're probably not going to give you estrogen. But guess what? You're still a good candidate for testosterone because that's still going to help you make you feel great. As long as, well, if you have not ever had a breast cancer, hold on, hear this. If you've never had a breast cancer, estrogen replacement also shows to be protective against breast cancer in the long run. So if you have a breast cancer and it's estrogen receptor positive, okay, that can definitely show an increased risk or you should not be getting estrogen supplementation. But if you have not and you've been healthy otherwise, it actually can be protective. Okay, so those are important things to remember, that these ideas get thrown around that estrogen increases risk of cancer, but in all honesty, it actually can be protective in both endometrial cancer and in breast cancer. So testosterone, same thing. People are like, oh, well, testosterone is going to cause prostate cancer. That's not necessarily true. So believe it or not, if testosterone replacement therapy is actually protective against developing prostate cancer. Now, if you have an active prostate cancer, you come in and we check your PSA and it's sky high, we're going to immediately send you over to the urologist and have that worked up. Because if you obviously have prostate cancer and we give you testosterone, that is going to increase the growth of that cancer and that tumor. So we do not want to do that. This is why we screen this very carefully. We screen it both with questions and also with lab work. And just in this last year, we've caught 3 patients with prostate cancer. And they came in because they wanted to get testosterone replacement, but unfortunately they weren't a candidate because they had something else going on. And again, we sent them to urology and got that taken care of. But again, we're very cautious and careful. But if you do not already have prostate cancer, again, it's actually protective against developing prostate cancer in the long run to have proper levels of testosterone. All right, so yes, there's some contraindications, but they're very small. And believe it or not, most of the things you've heard about hormone replacement is somewhat skewed the wrong direction. And believe it or not, it's actually protective. So what else? We also screen you, part of your lab work when you do your hormonal optimization. We look at vitamin D. Most everyone is low on vitamin D unless you're supplementing. We just don't get enough sunshine and we just don't have enough vitamin D. That is very involved in immune function, bone health, mood, and energy, and we want to optimize that, all of it. We want you to feel good. We want you to function well. We look at your thyroid. So this thyroid goes back to that chart I showed you with the standard deviation. So just because your thyroid is in normal range based on your labs does not mean that it's optimal. Okay, you might be low normal and nobody's ever treated it, but believe it or not, if we optimize that and get you somewhere into that upper echelon of the curve, well, guess what? You may feel great, and that may really do a lot for your energy levels. So that's something we pay a lot of attention to as well. We also look at your B vitamins, particularly B12, because it's very involved in brain function and energy. And so we really want everything to be functioning optimally. And if any of these things aren't necessarily functioning well or they're really low, no matter what we supplement with one thing or another, sometimes those are going to still drag you down. So we really like to optimize everything, the whole picture. All right, so everyone is different, and this is one of the last big take-home points. Not all hormone optimization is created equal, and not every person needs this or needs that. Everyone is going to be individual, meaning like we're going to go through a very, very specific symptom checklist with you. We want to know what your symptoms are. We want to know why you are interested in hormone replacement. Why are you not feeling well? What is it about your life that you really just think has changed that you need to be, supplementing for? We also are going to do an extensive blood panel. We're going to look at a bunch of different lab values. We look at those lab values not because we're going to say, oh, you're normal and kick you out. We look at those lab values because we need to know where you are to know how much we need to give you in order to get you in the optimal range. And we also are very thorough with our history taking because we want to make sure that we're not treating something inappropriately because you have a history of some other type of, again, say prostate cancer or breast cancer. So again, very thorough, and it's a very personalized approach to each individual patient. Guess what? Life changes, and so do we. So when your life changes, so let's just say a woman comes in, she's been getting a little testosterone optimization, and now it's been a few years and she's like, you know what? I was having regular cycles when I first started this, but now I'm hardly having any cycles at all. I don't remember the last time I had a period. Well, okay, are you feeling anything else? Well, yeah, actually I've been having night sweats and I just sometimes will get all flushed. Guess what? You're having hot flashes. So yeah, your estrogen level has started to drop. You are now going into menopause. And so we start to optimize your estrogen as well. So again, just because we have a plan up at first doesn't mean it's going to be the same plan long term. We want to make sure we optimize this as your life changes. So that's also very important. All right, so again, this was kind of done in a webinar format, and so I think we have some questions that have been proposed. The first one looks like,
have to do this forever?
Okay, so when someone, the first question somebody, again, people are a little bit skeptical. Sometimes everyone's a skeptic. They walk in, they're like, well, this is expensive. Do I have to do this forever? And they also ask, is my body, once I start this, am I going to have to do it because my body like needs it? Well, I'm glad you asked that question, because it's important to understand that with hormone optimization, we give you the supplements. As soon as your body, say you stop doing it, as soon as your body stops getting that extra hormone, it's going to go back to right where it was before we started. Okay? And you're just going to see that gradual, steady decline throughout your lifetime. So the question usually becomes, after the first time someone gets pelleted, instead of asking, am I going to have to do this forever? And this is expensive, I don't want to do it again. The question comes back as, I just want to make sure that I'm okay to keep doing this. I want to do it again. Can I do it again? Can I do it? How soon can I do it again? So again, people feel great and they're really excited to be part of the hormone optimization because again, they just feel amazing. And so the question stops being, am I going to have to do this forever? And it becomes, can I please do this forever? Because that's how you're going to want to, that's how you are going to feel. All right, so what's next?
What if I had a hysterectomy?
Okay, again, excellent question. So if someone's had their uterus removed, or which is a hysterectomy, and their ovaries removed, which is oophorectomy, that means they've had all their lady parts taken out. Well, guess what? That means you're making next to zero hormone. So you're the perfect candidate for hormone optimization. And so, we change things a little bit because we know that you're not making anything. We don't necessarily have to use any progesterone because, again, you're not going to have any risk of increased endometrial cancer because your uterus has been removed. So yes, you're a great candidate for hormone optimization because we can make you feel amazing by getting those hormone levels back to where they were before everything got removed. So yes, excellent question, and yes, you're a great candidate. We change things up just a little bit, but yes. What else?
How big are the pellets and does it actually hurt?
Okay, so another great question. So when we do the pellet placement, the pellets are, I'm going to say they're similar to a grain of rice. You can have a long grain of rice, a short grain of rice, jasmine rice, whatever, but it's just a small little pellet. The worst part of the whole process is the numbing part. Just like when you go to the dentist, that first numbing stick is uncomfortable. But once you're numb, and again, that's just a quick little stick, we usually place them just in the subcutaneous tissue on your buttock. We can also place them in the flank or even in the abdomen. But we numb you, and then we use what we call a trocar, which is a small little metal push rod that we can place the pellet with. Women typically just get one simple little push. It's a very small little pellet, and that's all they get. Men, we have quite a bit more testosterone, and so we typically give anywhere from 8 to 12 pellets. And so we'll be back there for a minute pushing those pellets in. But again, you're not feeling anything other than just maybe a little pressure. There's no pain involved once you're numb. And again, the numbing process, we use the smallest needle and we use a very rapid acting lidocaine. So usually you're numb very quickly. So pain is at a minimum. The procedure is over with in just a few minutes. Literally, it's very quick. And again, women, much easier. Men take a little bit longer. But soreness, maybe for a couple days. We don't do any stitching. We literally just put a little bandage or a steri strip and then a waterproof bandage over it. We recommend keeping that on from anywhere from 3 to 5 days or 5 to 7 days, depending on how we think you're going to heal. And once that peels off, you are back to normal activity, doing whatever it was you wanted to before, and honestly, probably doing a lot more because now you've got hormone optimization and you feel great and you want to get out and do stuff. All right, I think that was the last question. So in general, I want you guys to understand that hormone optimization really is for everyone. Anyone that's got these gradually dropping numbers is a good candidate. People that have had surgery to remove things, again, a good candidate. So if you're interested in hormone optimization, we'd love to help you through your journey. We start out with a simple consultation where we take all your history, we do the blood work, and we try to determine if whether or not you're going to be a great candidate. So if you're interested, don't hesitate. Call today. You can email, text, anything. We'd love to help you out. See you soon.